Okay. Hello. Huh? Yeah. Can everybody hear me? Yes. Okay. I got a thumbs up. Thank you. All right. Perfect. Sounds like folks online can hear us as well. All right. Well, welcome back from lunch. Thank you for joining us for the afternoon. We are going to go ahead and get started. Here, let me take the lunch off of the screen. Oh, that is. Just a second. I don't know why it's not. There we go. Goodness. Okay. Hopefully everybody can see the right thing now. Sorry about that. Okay. So we are going to move into our outreach and engagement panel. This conversation is going to be focused on the important work of connecting communities, understanding consumer needs, and building partnerships that help people access health coverage. We know that outreach is more than sharing information. It's about building relationships, creating trust, and making sure consumers have the support they need from people they know and communities that they rely on. So today we're excited to hear from members of our outreach team who work directly with communities across Oregon. We want to invite everyone to think about your own communities while our panelists are sharing and what outreach challenges you're seeing. And that way, when we're meeting in a little bit, hopefully you can share those with us at some regional tables. So joining us today, I've got Misty Rias. She's our deputy director. She's been wandering around, so you guys have already kind of met her. Misty provides leadership and support across our marketplace work and brings a broad perspective on connecting outreach and engagement work to our overall mission. And down here, a couple seats from me is Allie Wilgus. She's an outreach and education coordinator for Northeast Oregon. She works directly with communities in her region, supporting outreach efforts and helping connect local partners and consumers with marketplace resources. And then we have Federico Corzo Fernandez. He is our outreach and education coordinator for Western Oregon. He focuses dually on connecting with communities in Western Oregon while also focusing on building relationships and leading outreach efforts with Hispanic and Latino communities across the state. And last but certainly not least, we have Israel Estrada, who is our lead outreach and education coordinator. Israel supports outreach and education efforts in South Willamette Valley, helping communities access information and resources while also supporting the team and the marketplace meet outreach goals and make advancements to outreach work. So thank you all for being here. So we'll go ahead and get started. So to start us off, Allie, can you start us off by telling a little bit about your role, what outreach and engagement looks like in your work and with the communities you serve, and then if the rest of you don't mind sharing as well.
All right. I love being on a microphone, by the way. So we'll go through this. I would be much happier if this one didn't work. Thank you so much for the introduction. And as Amy said, so my name is Allie Wilgus. I am the Outreach and Education Coordinator for the Marketplace in all of Eastern Oregon, and then the Gorge and back up to Central Oregon and far East Oregon, all the way out to Ontario and Malheur counties. So a lot of our job is focused on making connections. So we do policy work, and that's great. But if we aren't able to reach you guys as our community partners or be out there with our communities that we serve, we're not really effectively being able to educate the policy that is in place. So what that looks like for me is connecting with hospital systems, connecting with clinics and rural health agencies, sometimes agents, although I wish I had more of a connection as I see a lot of agents here today. But when we're out there and present and are able to make those connections, we do build those relationships and trust. For me, that also looks like allowing people to know that I am a local and that I share the same goals out in Eastern Oregon and across the state as the people that I'm serving. There's a lot of mistrust that can happen with state agencies, and so I'm able to build those relationships, be an open ear for any question or misinformation that might come up that I can help clear up and meet that person on their own common ground. So the other half of our outreach, we attend events because we have to be out in the public in order to make those connections with the communities that we are serving. And I get a lot of strange looks and a lot of questions when they say, well, where are you going to be? And oftentimes, especially in rural Eastern Oregon, those events look a little bit funny. So I attend a lot of fairs, rodeos, parades, music festivals. Beer festivals are things that we've attended before. And you're like probably wondering why we'd send a state representative to a beer festival. We need to go, as our Disney family here with the Marketplace says, where the people are. And we need to go where the people are that are not likely to seek out health insurance information on their own. What demographic tends to be the one that doesn't want to go find health insurance information? Late millennial males. So we're looking at our single male population a lot of the time. They're new to the workforce. They don't have a mom still helping them with health insurance. We need to meet them where they're at. So monster truck rallies, music festivals, and we do surprisingly get a lot of questions or a lot of side looks, circle back, side looks again, grab something, come and talk to us, which brings me to my next point on why we're out in the public in that way as well. So statistics say it takes 3 to 7 exposures to a logo to start to recognize it in your brain. And then another 7 to 13 to become curious about what that logo means and how it could mean something to you. And then upwards of 20 meaningful connections with a logo or a name for somebody to reach out, connect, and be curious to come talk to somebody about what that might be. Every event I attend, I was at a music festival a week ago. It surprises me how even people in the healthcare industry will come up to me and not know what the Marketplace is or what we can offer. Happens all the time. So we are doing meaningful work with being out in the public and being able to have these conversations, even if they don't look like you would think they would. I encourage all of you, since we're sitting in front of you, to think of events, think of things that maybe you would like to partner with us, be in attendance with us, or something in your own communities that we might not be seeing, so that we can hopefully get out there more. With that, I know I talked a lot. I'm going to hand it over to who would like to talk next.
Hi, I'm Federico Corso Fernandez. I do everything that Ali does. And also because I'm bilingual and bicultural, I go to many Latino events, especially the events from the Mexican consulate where people from all the state go to the event. It's very important to me or for the people to see a familiar face. I'm off? Oh. So it's very important. It's make the people more trustful to me because I speak the language and I know their culture, especially in these moments where a lot of people is scared about the political environment and all the stuff is going around. So I go also to schools. I go to community events, community meetings, and small businesses. So I've been all around the place.
Israel Estrada, I am the Senior Outreach and Education Coordinator for the Marketplace. So similar role to Ali and Federico, except I have a couple different responsibilities, mostly involving kind of helping the rest of the team get started. So what outreach kind of looked like for me, one of the first things I started to do was, what does my region look like? And my positions changed pretty recently, but up until December of last year, I was covering Coos, Curry, Douglas, Jackson, Josephine, Klamath, Lake, and Lane counties. So a really big area that I had to cover that was very diverse. Eugene, very different than Klamath Falls, different populations, different groups. So had to learn about what was out in each area. Like, oh, we have some tribal partners in these regions, the Klamath tribe, the Cow Creek, all these different groups I was trying to identify, figure out which ones I'm going to work with so I could prioritize my time. So one of the things I'm doing right now is I help the rest of the team. Here's what your region looks like. Here's the population. Here's the age breakdown. Here are the major ethnicities. Here's the breakdown of languages they speak. So I wanted to get them that information so that they could find out what their regions look like so that they can serve them better. So a lot of my job is helping the rest of the team kind of get their feet under them, help them identify things that they may not be thinking of. Because what I've learned when you're part of a team like this, there's events like when I was doing this, we talk about being at these events. Like, I'm a nerd. I go to Comic-Cons a lot, card shows. So I started thinking, well, can I do some of these in my region? So finding out which ones were in my region. And some of my coworkers that handle the Portland area, hey, have you ever done Rose City Comic-Con? It's like one of the biggest events, and now it's a pretty popular event for us for the times that we get to do it. But I learned from them, they learned from me. Like, I'm not a big outdoorsy guy, but I do sportsman shows because that's what my region looks like. Lots of sportsman shows in the area. So we do this the sportsman show in Eugene, Klamath Falls, Medford, and sometimes Roseburg. They make it hard on me because they put that one on Super Bowl Sunday. So I have to make some choices. But yeah, we learn the population, figure out who it is that we're serving and once we know who we're serving, we can look for those gaps, try and identify, okay, where am I going to get a lot of support in this area? What area needs support? If I get what I try to do in my personal outreach strategies, I try to create advocates for us. So I go out in that region and I try and get everybody, all the assisters that I can out there, the reference librarians at different places. I want them trained up to know. They don't necessarily have to know everything about the marketplace and about what they do, but hey, you got a question about this? Call Israel. Email Israel. He'll help you out. That's what I'm trying to do because it helps those people do some of this outreach work for me. And that's kind of that's been my personal approach towards this.
Excuse us while we play hot potato with the mic. So we know, and I think everybody in the room knows, that every community has different needs. So how does your approach change based on the region, the population, and the community that you're working with? I know you all kind of talked about this a little bit, but Federico, would you like to start and kind of dive a little bit deeper?
Yes, like I said before, because all the political environment is been around the Latino community, I like to support the community members. I build trust through relationships. So when people see the same face, they're gonna start building trust on that person or that agency, so they can start making questions or ask for help. Also, we need to choose safe and neutral locations. So like libraries, public schools, because people is afraid to go to like state buildings. So yeah, that's my approach that I do right now.
Oh, sounds like, do you all feel like you spoke enough about your approach? Yes, good.
Formatting issues there. I think that Federico said exactly it. In our community, we need to make sure that we're reaching the population in which we serve, and ways that are great to do that is, attending any local community events. So fall time out in Eastern Oregon and the Gorge, we have harvest festivals. So those are another things that I think about being a part of, making sure that any community resource center, such as libraries or work source centers, partnering with DHS offices, even though a lot of that population may not be our population that we're serving with Marketplace, they're a foot in the door that we can let people know about the base information to come on over, have a conversation with us, and what else is out there. We are always looking for other ways that we can reach more. And when we have a room full of minds like you guys, that's really what helps us figure out where are we missing, what have we done before? That's great, but how do we build on this? So we would love to hear from you so that we can change our outreach plan to fit your community, because your community may not exactly be what my community is, and that will help me learn what your community is so I can be out there with you.
And I'll basically just touch up on what I mentioned just a few moments ago. What I like to do when I'm out there, I'm talking to those people, figuring out what they do, and there's different needs across different parts of the state. If you're in an urban area, like in my area, in my region, it's Eugene is the urban area. What it is, lots of resources available. So what is it that I can bring to this? Well, I can help direct people to those various resources, whether it's assistance with one of our agents, one of our grantees in the area, just knowing what's available out there. So if somebody comes up to me at a booth, because when they see me at a sportsman show, they just like, what do you guys do? Well, this is what we do. Well, hi, I have a question about this. 9 times out of 10, probably I'm not getting a question directly about the marketplace, but I'm like, oh, you need help? Why don't you go on 7th Avenue in Eugene? There's a Charlton Clinic. It sounds like you're gonna need help with the Oregon Health Plan. Somebody there can help you with that application. Or we have a grantee that you can talk to because you need help with the marketplace or Medicare. So we started with that no wrong door policy, and I still fully believe that the majority of people that I'm talking to in the public may not necessarily be marketplace consumers now, but maybe down the road, or maybe they have a friend or family member that could be a marketplace representative. They remember, hey, that guy helped me out. Maybe he can help my son out. Maybe he can help my mom out. And then also the other regions. So a more rural region, sometimes they're just happy you showed up. They feel like Portland, Eugene, those big areas just get all the attention. And when they see somebody, I'm at those events, like, what are you doing here? We're getting the word out, just helping people out. Oh, well, where'd you come from? Do you have an office out here? Oh, no, I drove from Salem. You drove 4 hours for this event that's going to have 50 people? Yeah, because you guys are the one that need that help most, because fewer resources in this area, so fewer places to go. I can help you get to those resources. So that's the way I view things, and that's how I try to help.
First of all, I just want to say this is an amazing team, and this is only 3 out of the 7. We have some new team members that have joined that are learning their areas, so you'll see new people out in your areas. But in addition to the boots on the ground and hearing from community and what community needs, we also do like the back end work. So we have a holistic strategic plan that the team starts out with. We start working on that in February for the upcoming year. And it's, here's the places we think you should hit. Here's the things that maybe went wrong last year. Here are the places that don't make sense to go to. Here's what we identified within your region, why they're out there, that maybe we need to support more next year. And then we're collecting that data throughout the year. So the team is not just going to events, they're going to meetings like service integration team meetings with leaders that are there from communities and different resources, and finding out where events are. And then they're gathering information from that. We're gathering data from all the events we attend. What type of folks are there? Is it Medicare folks? Is it Medicaid? Is it Marketplace? What kind of questions are we getting so we can support community better the next year? And then we're taking all that data and using like a Smartsheet form and collecting it all so we could not only see where we've been and where we're hitting, we're also where we're missing, and we need to readjust. And we make adjustments throughout the year when we see those gaps as well. And then we we take that for the next year, like I said, so we can plan our strategic planning for the next year. Maybe there's things we take off the list that weren't hitting the mark and add things that are. And this is where you all come in, right? So when we're at those meetings with you or the collaboratives that are hosted by the regional outreach coordinators on the Medicaid side, hearing events, hearing things that are going on, so we can also be there and support and get that in our plan for the next year.
Thank you. So what are some of the biggest challenges or questions or concerns that you're hearing from consumers right now, and how can our agents or assisters help address them? And Misty, we'd love for you to weigh in on this.
I think the biggest one that we have been hearing recently, because it's bubbling in the news, is Pacific Source and Providence going out, right? And what does that look like for your consumers? What does that look like for your clients when they re-enroll for this next year? And just really, I was fortunate to sit at a table with Shannon and just kind of hearing her talk about like getting the jump on it, right? Looking to see where they're going to have in-net providers with the new carriers that are not new, the 4 carriers that are moving into the marketplace for 2027, and getting them set up so they do have that coverage in advance. So that's what we're hearing already is, well, what am I going to do now that, Pacific Source is my carrier and I love them and I want to stay with them and they're not here anymore. So that's what we're hearing the most.
So another thing that I've been hearing, and I'm sure it's happening across the entire state, although not a lot, and it was more a couple months ago, but I think it's important to note, is the question that's come up multiple times for me is, oh, so you mean the help that's going away? It's ending, right? Meaning our advanced premium tax credits that we offer through the marketplace. So there is misinformation that's out there, and we can be such a big help to our communities by helping reinform them exactly what that was, what did end, because we hear things in the news and it kind of triggers people into just hearing that soundbite. The juicy piece of information that's going to get people hooked, but not the whole picture, which, no, we still have financial assistance. We always will. We're not going away. And things are changing, but let's talk about how they're changing and how we can still help you. So I think everybody in this room can really help us with kind of educating. Of course, that's our job, and we do a lot of it, but helping educate those consumers that think that things are ending and it's going to be dire straits for them. Reassuring them that no, these things had an end date. They were planned on being ending. It's not a new change. It's just something that we're moving forward with. And here's how we can help you. So really reframing the picture into ways that are positives for them and some of the protections that they have by still being with a marketplace plan is kind of how I approach that when that comes up.
So I guess one of the main concerns that I've been seeing, just basically touching up on Misty's point, is kind of the education piece regarding what's going on with Providence and Pacific Source. So talking to the public and quite honestly, some of the sisters as well who don't understand there's a different relationship. So you have Providence, the insurance company, versus Providence, the service provider. And what a lot of people are thinking, like, oh, the insurance company's going out, my doctor's going away too. Like, that's not necessarily the case. Providence is still going to be keeping many of their doctors, many of their clinics at this time. They're not shutting down their service network, just the insurance side of it. So, what I would recommend doing, talk to your doctor, find out, what other companies that he's going to be contracted with so you can try and keep going to that doctor. So really just, for me, it's that education piece about, hey, these are two separate things. Just because one's happening doesn't mean the other's also going away. So it's one of the key things I've been pushing out, both at my collaborative meetings and then out in the public.
And also, I would like to add that it's very important that we keep informed, not only about the marketplace, also about all the options available for the public. So if we are very informed, we can help better the public.
Thank you. Israel, I'm going to jump to you for this one. Can you share an example of a partnership or outreach effort that has made a meaningful impact in your region?
I'll go with two if time allows. So the first one is when Jackson, Josephine counties were my territories, one of the things identified pretty early on was plenty of agents, plenty of assisters that speak Spanish, no agents that spoke Spanish. So some of the agents in the area would use like a translation service, which sometimes that population is still not comfortable with that because they feel that stuff is being lost in translation. So what I did, UNITE, thank you for this. I worked with an agency in the region called UNITE who focuses on farm workers. Many of them speak Spanish. They were already doing the assister work, but by working with them, basically they helped kind of pick up that slack, making sure that they were starting to do those marketplace applications as well. So, hey, they couldn't find an agent that they were comfortable going to because they didn't speak Spanish. Well, here, we have this other place that you can go for that Spanish assistance. And then this is kind of a statewide thing, but we do something called what are called rapid response events. For those of you that aren't familiar, basically when a big company or when a company does a layoff of at least 20 people, they send resources to that company to talk to their employees as they're being laid off. So you got unemployment, the employment department, WorkSource Oregon, and ourselves. And so we're talking to people while they're losing their health coverage. So while they're in the midst of a special enrollment period, where their income is dropping, where they may potentially qualify for OHP. And at these events, it may not be the highest priority there, but definitely the people where healthcare is a high priority, they're coming and talking to me after the presentation to get help for their specific, to answer those questions specifically for them and their family. And it's one of those cases of meeting them where they're at and catching them when our advice and our help is most beneficial. So that's one I'm pretty proud of.
I'll go ahead and share one real quick too. So when I started as an outreach and education coordinator about 7 years ago, I had an organization out in Baker County that would turn in an exemption to our training requirements every year. And they did not want to take our marketplace training, and they had a valid reason. They are a treatment facility that serves mostly only court-ordered treatment. So the consumers that are coming into their treatment facility are handled by OHP. They say, we don't do marketplace at all. Why are we taking this training? So they had an exemption the first year. In the next year, I got to know them a bit more. I went to meetings out there. I talked to their assisters and talked about the type of work that they were actually doing. And they were able to realize that although they may never do a marketplace application, they potentially could, because when they are working with these people in treatment and helping them set up for a better success rate leaving treatment, being able to share information and knowledge about marketplace of what could be out there. Maybe they're going into a trades type job or with a small employer that's not going to be able to offer them insurance. So they're coming off OHP insurance. That's really good for them, and then going to move into having no insurance again. That could cause all kinds of problems for them. So that partnership, that organization, that treatment facility, they now host my training every year, and they all take the marketplace training just for information knowledge. So I think that's I'm pretty proud of that partnership, but I think it's important to note that maybe vice versa. You don't do any OHP at all. Get to know your OHP assisters or organizations in your area so that you can be that helpful person that can offer marketplace assistance when they have somebody transitioning off OHP, so that that person's conversation with the consumer doesn't just end at the end of, hey, you're no longer eligible for OHP. See ya. Here you go. Go find your own way. They would actually have a friendly face in you in the area that they could point you in a direction of saying, hey, marketplace is out there. It can really help you. This is a friendly, happy, smiling face that can go help you with this marketplace coverage.
For me, one of the relationships that made a big impact is the Mexican consulate, because when I go to the resource fairs, I can talk and see people from all around the state that speak Spanish, and they don't know about the marketplace or OHP. They don't know about any other services available in the community. So for me, that's a very impactful relationship or partnership for the marketplace.
Thank you. So everyone, for the partners here today, Can you share what is one thing that they can do to strengthen collaboration with our outreach and better support consumers? Allie, would you like to go first?
So I think I just touched on it before in my last response. Get to know the people in your community that may not traditionally look like somebody that would make sense for you as a marketplace agent or community partner. Reach out to us. Let us work with you with those communities to help bridge the gaps. The other thing that I want to bring up on this as well is there's been a lot of changes over this past year with new programs, with new OHP programs, and then with Marketplace and all of our changes that we are going through and then moving forward, which are wonderful and positive, but that's a lot of change. We're trying to figure out ways to think outside the box. So if you can help look at your communities, reach out to us and say, hey, I think this population could use more help. I think this population really needs marketplace information, but we might be missing it somehow. Personally, I've been trying to look into our small business and small employers. There's a lot of farms, a lot of farmland out in Eastern Oregon, and I think that sometimes the people that are working in those environments are not getting our outreach. So I'm really working with the communities to try to find new and different things that I can be out there to share marketplace knowledge with.
My piece of advice, I guess, would be, work with us. Talk to your regional outreach coordinator, whoever it is. And if you have the bandwidth, go to those OHP collaborators where you're talking to other sisters, other people that are talking to these populations. I know just firsthand experience that in my region, those agents that would attend those collaboratives make those relationships with those sisters. Those become strong relationships, and it's hey, it's not just, oh, go call this place and they'll help you out. It's like, oh, go talk to Jody at Burns Insurance. She'll help you out with this process. And your mom, you said your mom was having issues with her Medicare. She can help with that as well. Those relationships are all there for you guys if you're just willing to reach out and take that help. And then also, feel free to ride on with us. We talked about all these events that we table at, Comic-Con, sportsman shows, rodeos. We're always looking for helpers, and if it can be somebody in the area, you get to have a spot with us, supporting us at the table, talking to those people face to face, and I'll have those questions like, oh yeah, this is what I can answer for you. Oh, you know what? That's a Billy question. Billy, do you want to help them out with this? Help us out with those events. We're happy to have you. That doesn't cost you anything except your time.
Also, I would like to add that I would love to see more agent partners to have bilingual stuff. For some reason, I noticed there is no a lot of assistance or help for non-English speakers. So just let us know what we need to do in order to achieve that.
So looking ahead to the next enrollment season, we all have open enrollment on our minds. Misty, can you start off the group by sharing what is one message or takeaway that we would want to leave our partners with today?
I think for me, it's we're here for you. So we are a small team, but there are 7 outreach coordinators. So you can reach out to them within your regions if you have questions, if you're having issues with, learning the application, learning the platform. We also have a Oregon-specific customer assistance center, as Miranda and Katie O shared earlier in the day. So if you're finding issues with that, let us know too, right? Because we're seeing their training plan, we're doing quality assurance on that customer assistance center. So we want to make sure it's providing 100% support to you all as our partners. I think the other thing is, Michael Wallace, of course, is the dedicated agent liaison. So if you have agent-specific questions, definitely reach out to Michael. His email is always, there's an email specifically for agents always on the slides when we collaborate. And then, of course, he gives out his number. And then Ednadina Lopez, she's not here today, but she's our community partner liaison. Same goes for her. Like if you have questions, make sure you reach out to her or your outreach coordinator. And then we also have a Marina Cassandra, who is our tribal and provider liaison. So she's there to support as well. So just knowing that we're here and you don't have to wait to get those answers, you can reach directly out to us. I think that's the big thing. And then just excited and thankful that you all are here going through this transition with us.
Yeah, like we are here. We are here for you. Do not hesitate to reach out to us if you need any help, if you have any questions. Like Israel says, you can go with us to table at the events. In that way, people can know you. You can talk to people directly. So please don't hesitate to reach out to us if you need anything to help the people.
Yeah, pretty much the same. We want you guys to be successful, and we want to help you be successful. Also, remember, we're going through a ton of change this year, but please remember that you know this. You know the marketplace, you know what we have to offer, and you know your communities and how you can help them. So don't get scared because we're going through such big changes this year. The base knowledge is all the same. We just have a new and improved and better system and the ability to help you guys.
Yeah, and I kind of follow up with Ali's point. I was basically going to say, I know there's a couple different audiences in this group. We got sisters and agents. Really, for a lot of these sisters, it's not going to be much different for you. I know in my region, you do the OHPA applications if you have to, or if you really have the time, you're really embedded in it, you do the marketplace applications. But a lot of you will make those referrals out to agents in your area to handle those marketplace applications. If that's what you're doing before, that's not really going to change. You get a marketplace person and they want that marketplace assistance, get them over to one of our partners, get them into an agent for that assistance. And other than that, for everyone else involved in the other side, the agents, yes, there's a lot of work involved, but most of it's for us. You know, we have to make sure that the system's up and ready for you guys, but you know, all those rules regarding eligibility, all the knowledge that you have about how to make plan recommendations, that's all going to be the same. All that's changing is what platform we're using to apply that. So yes, there will be some changes, but it's not as big a change as I think people are worried about.
I forgot to put a plug in. Don't forget to go to our training. So we have training already listed online. We have in-person trainings throughout the state offered. So please, if you can, go to the in-person trainings. I think they'll be way more beneficial because you'll be able to also hear the questions from your counterparts and you'll learn from them. And then after we roll through some of the in-person trainings, we'll start offering the virtual trainings. And then, of course, the last option will be on demand.
Okay, well, now we're going to open it up for questions from all of our partners. So we would love to hear what questions you have, what you've been seeing in your communities, what additional support would be helpful, and anything else.
We did have a comment from someone online. Please look into touch points with more colleagues. So many students are uninsured and don't know what options they have, especially on the international student side and students at school in Oregon that is out of state of their hometown. International students here on a student visa really need more access to help navigating insurance. And then there's a question on, will there be customer service reps for the exchange that can help those who speak languages like Chinese, Korean, Vietnamese, and Russian? This is a big population in Oregon.
Yeah, so the question is if there will be customer service available in other languages other than English, and the answer is yes. We will have bilingual Spanish-speaking representatives, and then we will also have interpretation services available for a whole myriad of other languages. Any other questions?
There is another question online. Will there be more online webinars? Many agents live out of state but serve people in Oregon.
So a question about online webinars, I'm assuming for certification training, and Michael Wallace is giving me the thumbs up that yes, there will be online webinars. More information to come.
Please wait for the microphone, sorry.
Sorry. Back in the day when we had the, covered Oregon, for those of you who were around in those days,
That name's not allowed here.
okay, the state used to run these great enrollment fairs. And they would have community partners and agents there, and it was just like a massive enrollment process that would go on. I know in those days we had a lot of trouble because there were paper applications and things like that. But are there any plans to do something like that this time because of the change?
It's a great question. So the question is essentially if we're planning on doing any enrollment fairs this year. And what I can tell you is we don't have any currently planned. However, I am looking into what options might be available, especially if we have partners who are interested in partnering with us. So if we have any partners that are in the room who would like to partner on an enrollment fair, please feel free to send me an email or let me know. I think especially with the change with Pacific Source and Providence leaving, that leaves a really big opportunity, not just for folks on the marketplace, but for the folks who are direct enrolled to help them explore plans in the marketplace as well. So would love to explore the opportunity to host some enrollment fairs and get the word out about Explore Health. So thank you for that question.
And if you are interested in hosting an enrollment fair, let us know early because we will have some bandwidth to help send some of the outreach team out to help. Yep.
Any other questions? Oh, all right, we got a couple more hands, Katie. She's going to get her steps
I feel
in.
like Vanna White.
Not a question, just a comment. Ooh, yikes. Don't tell your clients to ask their doctors who they contract with. Yeah. They have no idea. Yeah. They don't know. And then we'll give them wrong information. Yeah.
Thank you. That's a great tip. And I'm going to repeat it for the people online. The tip was to do not tell your patient or your clients to ask your doctors who they are contracted with because they do not know. And Katie Button is shaking her head, so she agrees. Katie, since you've got the mic, would you like to share any recommendations on how people can verify that information or anyone else?
Sure. I really recommend people call their insurance carrier or the insurance carrier that they're interested in, and then be sure to write down what day they talked to the insurance carrier and what the carrier said. Because if the carrier told them that Dr. John Smith at the Newburgh Clinic is covered, and then later on that turns out to not be true, then we can make the carrier honor that. If the person looks it up on their own and thinks that's what they saw, we cannot make the carrier honor that. So always talk to the carrier and you can take that to the bank.
Great advice. Thank you, Katie.
Well, I just want to bring some feedback to you. I know that in the past, before we were granted to support the community through this program, personally, we invited you to some of our events. Some of you that are not, some of you that are not working anymore with your team, but you were very responsive and you came to offer the information. And also, you supported financially some of our events. So I just want to highlight that that's a tremendous effort and very efficient work that you do in the community. So thank you for that.
Thanks for saying that, Alex. The team is really out there and trying to do their best. And just something to think about too for community-based organizations is we do offer sponsorships. We also can, as Alex said, we can go and table as well if we have that bandwidth. I mean, is a team of 7, so they're everywhere, so it's a lot. But if there is opportunities to table or support an event that you're doing, it could either be through a sponsorship or through attending. So we would love to do that because we know, as the team has spoke, community goes where they trust and where they feel comfortable and where they visit. And so we are more than happy to sponsor and support events that we know people are going to go to.
Any more questions or comments or ideas? Yeah, do it.
Hi, everyone. Sorry to kind of take center stage for a moment, but my name is Nicole Betts. I work for Providence Health Plans. I'm the individual and family broker manager over there. So I'm your resource until the doors close. So I have a couple questions, and the biggest ones I have for you all are, what is going on with the state versus federal regulations and all of the legislation that's going on? Is there a place, a resource, where we can get that information? In my research, it's not publicly available, and I need some help.
That's a great question. So the question is, I don't know if that's me or, okay. I think you're just electric. It's just you. So the question was essentially where can you get information about state and federal regulations and changes and things like that. So with OHA, we are really, and ODHS, we're partnering together on all of the federal changes, and we're really cognizant that things are changing rapidly, and that we're being very mindful about the information that we put out to make sure that it's concrete before we actually share the information. We're also trying to be careful not to put it in multiple places. So OHA does have a federal changes website. If you Google OHA federal changes, it should pop up. I can also, with the recap for this event, I can send out the link. Yeah, and so that does have kind of a summary of everything that's going on, but that would be probably the best place to get information. The question was if that's going to be covered in the certification and training. We do cover some of the changes in the training, the changes specifically impacting the marketplace. And we cover them more in the sense of how it impacts the application or eligibility. We don't really cover anything related to Medicaid or any of that world because but there are other resources available. And if there's any questions that you have or anything, we do have we're happy to provide other information. Yeah. I'll repeat it.
So, talking about files, how far back
Someone's talking, we can't not hear online.
That is a great question. So the question was how far back the history is going to transfer from healthcare.gov, and I'm going to pass the mic to Chicky.
Sorry, y'all. I hurt my back last week. Some of my team, they're so nice about offering me food, running the mic to me and everything. So that's why I found it a little funny. Thank you, Israel. So only 2026. So the federal government's only allowing us to transfer. So they're only sharing and allowing us to upload 2026 information. Yes, and can somebody repeat that so I don't misspeak? So, okay, so the statement/question is for everybody on healthcare.gov, for consumers on healthcare.gov, The question is, will they also be required / have Explorer Health accounts? The answer is yes. Because those are two separate systems. So the federal government, they're responsible for keeping their system secure, and we are responsible for keeping the state system secure. So that's why there's very limited data that gets passed on to us, and that's why we can't share usernames and passwords. That's why they have to be completely separate. You're welcome.
That was a fantastic answer, Chicky. I would just like to add that for anyone who is helping a broker or a sister, if you're helping a client, you will be able to create an account for your client, and they do not necessarily have to access that account. They will be able to go in and claim it if they want to access it, but you will be able to fully help them even if they don't access their account. So you will be essentially helping them set up an account. Everybody will have an account. It's, if they want to access it, does that make sense? Okay.
Just a second, Katie's coming with the microphone.
So the question was, when can we start opening accounts so that we can start renewals? And Chicky will answer.
Hi again. So, okay, so this is assuming and hoping that everything goes well with the data migration with CMS. So once that happens, hopefully no later than September or October, anything that we can import from healthcare.gov, they will all have accounts already. So I did find out this afternoon and got confirmation from Get Insured. Our call center, our consumer assistance call center, that was redundant. Our consumer assistance center will be open starting October 1st. So consumers can start calling and asking for help regarding their account if they choose to do so. I believe we are still working through the logistics of what will be available for agents, but I do believe the plan is also for during soft launch, which is what we're calling the month of October, that agents will have access to their agent portal so that you can start viewing your books of business and make review and make request corrections also with a consumer assistance call center through the dedicated partner line. Please don't ask me what the number is because I haven't memorized it yet. So there's a lot of things we're still figuring out, but we are working towards giving you all access, as much access as we can for the month of October prior to open enrollment starting.
The partner line is 833-OR plans.
Okay, so I think, is it Robert? You had a question next. Do you still want to ask your question? Hold, please. Wait for the microphone, please. Sorry, I'm going to be that mean person today.
Thank you.
It was more just a comment to piggyback on what Nicole was talking about when she was asking about resources, and I wouldn't be doing my job correctly as past. Sorry, I'll speak loud too. As past president of NABIP Oregon, there's lots of resources available there as well. Now, is it working now? Yes, no, maybe. Yes, no. Okay, you can hear me.
But people online can't.
Okay, well then I will keep trying. So with NABIP Oregon, there's resources there at the national side as well. I sit on a national working group for the individual marketplace, and so there's lots. We're putting together a state database. It's going to have a record of everything changing whenever there's legislation at every state affecting the healthcare industry. It's going to be posted and show up on there as well. So that's another great place to go to kind of see and keep up with what's going on everywhere else.
So for those online who may not have heard, Robert just shared that there's a fantastic resource being created, and I'm sure he will share the resource with us so that we can also share it with you.
So question about the data migration. If those files are coming over from the marketplace in September or October, how will SEP enrollments that we're doing through the federal platform transfer over to the state-based marketplace for like an October, November, December 1st effective date?
So the question is about SEP enrollments for the fall, how they will transfer over to the state-based marketplace.
So we already have started importing data. So we've received data as of May of this year from healthcare.gov, and we have a few other iterations / cycles with CMS regarding the data migration. In terms of SEPs, I think there's one or two more after open enrollment starts to also include SEP information. I just don't have those dates right off the top of my mind at this time, but I believe there's definitely at least one. So, but let us get back to you with specific information in terms of maybe if you need dates, we'll be happy to find those dates and share it with everybody.
Thank you. Vixen.
Good, I'm getting my steps. So I keep hearing you say that agents, the transfer will go over to agents. If in healthcare.gov it's been listed like that I have worked with them as an assister, will those also be moving over, or is it just the agent's NPN number that's moving over?
So in healthcare.gov, assisters have not been able to be listed as partners. Oregon has never been able to list assisters as partners, so you will not have clients transfer over. You will have to go through the process to assign them to you.
But with that said, we already started working on that. So we started an audit already a few weeks ago. So you should have been receiving stuff from your outreach coordinators that's saying who, if you haven't yet, it's still going. It's still happening. Or they already have your information, Vixen. They already know who you are. So basically what we're doing is we're getting the managers of those organizations and making sure we have their address, all the information they need, and we're going to do like all the data steps first as much as we can for you. And so we're going to get all that together, and then once we get that together, we're going to give that all to get insured, and then we're going to set up the manager organization accounts for you all, and then we're going to have you go in and recognize those accounts and add your assisters. And then you can go in and request your clients. Longer process, but we want to make sure you all didn't have to do all that back-end work since it wasn't already available through healthcare.gov. So we're doing all the back-end work we can, so you don't have to do all of that except for add who your assisters are.
I think we have time for one more question or comment if we have any.
There is a question online.
Okay.
Yeah, wow, this one is loud. Will NPN overrides still be allowed?
Will NPN overrides still be allowed? Is Michael Wallace still in the room? I do not see him. Oh, he stepped. I do not have the answer to that, but we will get the answer and share it with you all soon. All right. Well, with that, I want to thank our panelists here for sharing your experiences and your insights. And thank you again. I mean, I can't say it enough. Thank you to all of our partners for the work that you do every day to support all of our consumers. The connections and relationships that you all build are really a critical part of helping communities access coverage. So with that, we are going to move into a little bit of an interactive activity. So hopefully you all are, not falling asleep and want to get up a little bit. We have a few team members. So Israel, Katie Button, Melissa, Miranda and Cable. So the next activity that we're going to do is breakout tables for supporting consumers. And again, this activity is really designed to be interactive. It's an opportunity to connect with your fellow partners, to share experiences and explore key topics. What we're gonna do is we're gonna rotate through 5 different stations. You're gonna have about 10 minutes at each station or table. Each station is focused on a different topic area. So we have reviewing eligibility with Israel, transitioning between OHP and the marketplace with Katie Button, enrollment best practices with Melissa Hendricks, considerations for American Indians and Alaska Natives with Miranda Amstutz, and data and reporting with Cable Hogue. At each table, you'll have an opportunity to hear from subject matter experts, ask questions, and discuss how these topics show up in your day-to-day work. Just think of this as a chance to share what you're seeing in your communities, learn from others, and take away resources and ideas that you can apply during open enrollment. I will let you know when it's time to rotate, but feel free to, move between the stations if you want. And for anyone who's on virtually, we will have parallel discussion space in breakout rooms. So feel free to join those. And we will be in this activity until 3 o'clock. So again, about 10 minutes for each table. So we will, let's give just a minute or so each of our subject matter experts can find a table to sit at. And then they each have a sign that they can hold up so that folks can know where you're going. Don't be shy. Melissa is very excited to talk to you all in the back of the room.
Hello, everybody. My name is Katie Orkes. I'm hoping that you all can hear me online. Please let me know if you can hear me.
We can hear you.
Yes, thank you. Okay, I appreciate that. So we've had to pivot a little bit from the breakout rooms. We are going to just take turns between the 5 of us that are presenting. So myself and Victor and Michael, Marina and Abby, as we go through the different topics that we each have. And then we'll take some time for some questions after each section that we go through. So apologies that the breakout rooms wasn't working as we expected, but we'll just roll with what we have right now. So again, my name is Katie Orkes. I'm the Marketplace Enrollment and Appeals Advisor. Been with the team for about 3 years now and 3 months in this position. So I'm just going to go over the reviewing eligibility to shop through Explore Health to obtain a marketplace plan. So the first thing that you need to be eligible for a marketplace plan is that you need to be a resident of Oregon. However, you can be temporarily residing elsewhere, like attending college. So if you have a college student living out of state, they are still considered an Oregon resident. Or if you're traveling for a period of time, you're also still an Oregon resident. Marina, do you have a question? I see your hand raised.
Yeah, actually, before we got switched over, I was trying to answer a question about the per capita versus welfare program income. So I just wanted to be available to answer that when you're ready.
Oh, okay. Let me just get through my section and then you can answer that if that's okay.
Absolutely.
Okay, perfect. So another important piece for eligibility for shopping through the marketplace is that you cannot be incarcerated. That means you are not serving a sentence in a jail or prison after being convicted of a crime. Not being incarcerated or not considered incarcerated is if you have pending disposition of charges, like if you're in jail and you're waiting the disposition or sentencing, and you've not yet been convicted of a crime. If you're on supervised release, so probation or post-prison supervision, and then also community confinement, you're on house arrest or living in a halfway house or residential facility. So those are not being considered being incarcerated. Also, additionally, alternative confinement. So if you've been convicted, but you're sentenced to a partial or limited form of confinement where you are not held in a secured jail or prison facility. The last but not least is that you need to be a U.S. citizen, a national or lawfully present. Some lawfully present individuals will be able to use Explore Health, but will not be eligible for financial assistance. And then to be eligible for that financial assistance through Explore Health, you need to be enrolled through Explore Health into a marketplace plan. It can't be just through the insurance company directly. You must be a U.S. citizen, national, or have a qualifying immigration status, which includes lawful permanent residents, certain Cuban and Haitian entrants, and COFA migrants. And you can also not have access to other affordable healthcare coverage. So for employer-sponsored coverage, the threshold for 2026 is 9.96%. So if your income is higher than that percentage to be added onto an insurance company is not considered affordable. So you have to meet that bar. Also, if you do not qualify for free Part A Medicare, you can potentially qualify for financial assistance if you met other qualifications and you do not enroll into Medicare. And then affordability for family members is determined by the cost of family coverage, not just self-only coverage. If family coverage costs more than the threshold percentage, as I mentioned, that 9.96% of your income, family members may qualify for the subsidies, even if the employee themselves does not. So that's the information to be eligible for shopping through Explore Health, and then the eligibility for the financial assistance as well. If there's any questions on the financial for the eligibility piece, I'd be happy to answer them or take notes if I cannot answer and get back to you. This question, how will we quote under the family glitch law on the new system? In Sherpa, we would be able to enter info on the app with employer benefit costs, but on the quoting website available, it only shows an option for eligible for other coverage, not accounting for the family glitch. My understanding is that the family glitch issue is not going to be an issue based on the way that our systems will be interacting with the one system. But Victor might have more information on that.
I'm sorry, I had to duck out for just a moment, so I think I missed the part where you just asked that question.
It's in the chat, Victor, the family glitch. Are you able to answer that one there? Can you see it in the chat, Victor?
Is it the accurately quoting plan for families if they want to see if they qualify for tax credits under the family glitch law? I think, is that?
Yes.
Okay. Yes, and that's, I believe, just part of the normal eligibility now. That's part of the eligibility flow. So it will ask questions that if there's a potential through the application enrollment flow that the consumer might be eligible or might have income and affordability coverage assessments that might fall into that category, that the flow will guide them in that direction, and it will kind of answer those questions as the application is going on. So if you're talking about just quotes, yeah, I'll have to get back on that one because I believe the sort of anonymous shopping should allow for the same kind of questions, but now that I'm not sure that it goes into that depth on just the anonymous shopping part, so I have to get back to you on that one. But that logic is built in there, and it should do that as well.
All right, everyone, it is time to change tables.
And we're not going to be changing tables, obviously, because we're all in the same room together, but we can switch topics, and I'll work on answering the questions that are left in the chat then. So we'll move on to.
And I'll see if I can respond to that in the chat. Okay.
Yeah. And then Victor, you're also in the transitioning between OHP programs and marketplace. That's your topic.
Gotcha. Okay, so I'm sorry. Was there stuff to present for that, or am I just in that table session?
There were some talking points.
KDB is part of that table too.
KDB is
Okay,
in person here in the room, but there should be
and I can
talking
just-
points.
Yeah, I can just move through those in that case. Is that, because I wasn't sure if this was just supposed to be questions to us or us talking about that first. So I can just kind of go over some of those points and see if that sparks any questions.
Sounds good.
Okay. So Explore Health, just for open enrollment 2026, the plan for moving from healthcare.gov to Explore Health is, at least in terms of the data migration and people coming over again from healthcare.gov, Explore Health will be conducting automatic redeterminations for the current healthcare.gov enrollees. Again, those are those that have active enrollments in the system. So when that eligibility determination, and that's going to be for everyone. So when that happens, some people that may be eligible for OHP programs would be referred to one, I guess, prior to open enrollment starting, if those are kind of found during those eligibility runs. And then this is a little different than the way healthcare.gov has done it in the last few years. The enrollees who are eligible for OHP Bridge would not be able to auto-enroll and stay in their Explore Health plan instead of moving to OHP Bridge. That has been the case in the past with the way healthcare.gov has conducted or not conducted eligibility redeterminations every year. But with this migration, we're kind of essentially forced to kind of redetermine everyone that's moving over. And so that'll include people that may be eligible for Bridge who again didn't make that jump last year for last open enrollment. And we don't really have any options there. That is kind of how that has to go if that determination is made. Because of the application processing timelines, people currently on healthcare.gov who are referred to one will be able to enroll in Explore Health plan for 2027. And with premium tax credits and cost sharing reductions, like while they wait for their coverage to start for OHP or OHP Bridge. And then once the coverage starts, they need to come back and end their Explore Health plan, essentially manually. Customers shouldn't end their Explore Health plan until they receive their eligibility notices from one. And then Explore Health system has included all the OHP program eligibility rules, so people should be correctly referred to the one system or one online, and those referrals should include more accurate information. So that should help reduce processing timelines, and the Explore Health system will display whether the transfer to one online was successful, so you'll be able to see that in the system, and what response one online has provided on that application. Again, that's for any of those customers you have visibility into. And then the current health Explore Health enrollees who report a life change that makes them now potentially eligible for an OHP program will be referred to one online. And applications that are batch, as mentioned previously, applications are batch processed every night. So only the last kind of transaction or interaction processed for that day and that last set of information that was ended up with in that account will be sent to one online if an applicant might be is assessed potentially eligible for an OHP program, and that should reduce the number of applications referred to one incorrectly, making sure that if any changes or tweaks or small kind of adjustments need to be made during the same day, that only again sort of that final one would be sent over. And hopefully reduce those processing times. And the one eligibility team needs to catch up with healthcare.gov referrals, or that first chunk of people that will assess for re-enrollment and eligibility redetermination right up front. So the impact may not be seen to the processing timelines right away. That might take a little bit of time to resolve or time to kind of show up, depending on when they start getting to those. So and I can just proceed to the end. The Explore Health enrollees that are referred to one when reporting Explore Health enrollees who referred to one when reporting a lifetime shouldn't immediately end their coverage with Explore Health. So waiting for the eligibility notice from one online will give the exact date for when OHP benefits will start. So logging into Explore Health and requesting to end coverage on the day the new benefit starts will avoid a gap in coverage. And then customers can also call in to Explore Health for help. And then referrals from one online to Explore Health will trigger a notice to be sent to the applicant based on their communication preferences. The applicant can access their account and confirm or update their application information. Again, that's when we get that referral from the one system from an OHP program to us when someone is no longer eligible. Then that information and notice will be sent to those customers to let them know, hey, your information is in Explore Health, and how to kind of claim that information or activate that account, potentially enroll. So that's kind of the nutshell of the transition. not just between healthcare.gov and Explore Health, but also sort of the ongoing back and forth between One Online and Explore Health. So any questions or anything I didn't see in the chat there?
All right, everyone, it is time to change stations. Also, we have a ton of food left. So if you would like to take food with you or coffee, please feel free to do so. But also, please feel free to change stations. All right.
I could deliver food to Hillsborough. That's also an option. Just checking.
I think that leaves Michael Wallace up next with enrollment best practices.
All right. Good afternoon, everyone. So we're going to cover enrollment best practices. So ensuring customers resolve data matching issues is a biggie. We want to make sure that's done as quickly as possible, of course. Another one is customers should claim their account with Explore Health. If they try to create a duplicate account, the system will give them an error message. So something to keep in mind. During open enrollment, actively enroll this year by checking everything. Do not assume plan is best fit for application information, especially income is correct. On the Form 1095A for 2026, that's going to be generated still from healthcare.gov, not Explore Health. So if folks are needing to get that form, that will be something they'll need to reach out to healthcare.gov for to request or actively look in their healthcare.gov account, and they'd be able to pull it there as well. We want to make sure to encourage customers to read all mail, emails or text messages. As they notices, text message notices from the Explore Health, so we don't miss anything or have anything fall through the cracks. And additionally, we want to make sure customers and you all are using explorehealthoregon.gov and not a bad actor site inadvertently. Upon launch, most Explore Health domains should route to our page. As an example, explorehealth.org, explorehealth.info, etc. So it's likely you'll land in the right place, but all the same, be vigilant that that is indeed the case. There is an auto pay button that will be available right after enrollment in the system to pay binder payments. If the customer, additionally, if the customers want to set up auto pay, they would have to contact your insurance company directly to do that. That's not something that can be done through Explore Health. We also want to recommend that consumer checks to make sure that their premiums are coming out each month to avoid coverage ending for non-payment inadvertently. So that's something even now we want to make sure folks are doing. It's a relatively short section. That's all I've got. Are there any questions on anything that was just covered? Hearing and seeing none, we can certainly move. Excuse me. I do see a question from Shay. How much time does the Explore Health expect data matches to be resolved after they're uploaded into the system? It's just an issue with the marketplace. It would sometimes take weeks to review and approve. I don't actually know the answer to that, Shay. I apologize, but I will definitely parking lot that question and get the answer. And we'll make sure that that answer will be included as available in our debrief or follow that goes out to everybody regarding the summit. Thank you for the question, though. It's a great question. And I'll put that answer into the chat as well. I believe, Marina, if you're ready, we could go ahead and go on to the considerations for American Indians and Alaskan Natives.
I am ready and excited to do so. I'm going to actually share my screen to show some visuals so you don't have to just listen to my boring voice. I'm sorry I couldn't be there in person today. I really was looking forward to it. I did lose a fight with gravity, and so I'm unable to drive today. Nope. I don't know if this is working, but okay. Can everyone hear me okay?
Yes.
And thank you. And can you see the slides?
Indeed.
Wonderful. And I do want to quickly, before I forget, address the question that was asked earlier. This is a very nuanced question, but I'm really glad you brought it up because not everyone is aware of the difference between per capita income and social welfare. So I did learn from tribal representatives in tribes who are in Washington state that some of their tribes have elected to go with a social welfare categorization for their per capita payments. And in those cases, they are not counted as income. So if the income is still categorized as per capita income, I believe that will still hold true that they will be considered taxable income and included on their MAGI calculations. We can definitely confirm that, but that is what I know so. So private coverage for American Indian and Alaska Native communities. Enrolled members of federally recognized tribes can use marketplace health coverage at Indian healthcare providers and beyond. So with specialists, local hospital, and others. And it really depends what their household income will determine their cost sharing reductions level. So we'll get into that. And these are just examples, specialists, local hospital, other providers. There are other things as well. So the cost sharing for enrolled tribal members from 205%, which is the cutoff for the basic Medicaid program, the basic health program for American Indians, Alaska Natives, or those classified as historical Native or Heritage Native American on the OHP side. Their cost sharing will be that they pay nothing out of pocket. These are the consumers, pay nothing out of pocket for covered services on any plan through healthcare.gov, regardless of network. Sorry, that shouldn't say healthcare.gov. That should say Explore Health. Sorry, we didn't catch ourselves on that one. So household incomes at or above 300% will get what's called limited cost sharing. So they'll still pay nothing out of pocket for covered services provided by Indian healthcare providers, but also those who are referred by Indian healthcare providers on any plan through healthcare.gov. So all covered services and providers are considered as in-network for tribal variants in Oregon. So that's pretty cool. Any questions on this part? Because it is a little bit specific. This doesn't follow the general population guidelines. So just want to make sure. Also, in order to obtain these benefits, they have to be on the tribal variant of the plan. So if there are household members who, if they're all on one plan, but not everyone's on a tribal variant of the plan, then those not on a tribal variant of the plan will not get these benefits. Or to say it more positively, you must be on a tribal variant of the plan in order to receive these benefits. Tribal premium sponsorship program. So there, this allows this through the Affordable Care Act. It allows, this has been changed. Let me just say it correctly. It allows the tribes to determine if they want to have a premium sponsorship program for any of their members. They would be the ones deciding the eligibility for which members get to participate. And right now, the federally recognized tribes in Oregon, of the 9, only 1 has such a program. But tribes can reduce the clinic expenditures by accessing financial help through the marketplace. In other words, they could bill for services instead of paying for the services, and they could also bill for any specialty care that they refer out. You could let consumers know about the TPS Tribal Premium Sponsorship Program and advise that they may contact their tribe to see if they qualify for this additional assistance, because there are tribes outside of Oregon who do have TPSP programs, and that each individual tribe will determine the eligibility. So they would need to check with their tribes to see if they qualify for that. Special enrollment periods for tribal members allow enrolled tribal members to enroll in or change or disenroll once per month through currently healthcare.gov. So that means this would apply to 2026. In 2027, of course, they will be able to do so through Explore Health. Household members of a tribal member can also access that SEP if the tribal member is also making a change to their coverage. So if the tribal member in the household is enrolling, disenrolling, or changing plans on currently healthcare.gov or we're in next year for Explore Health, then the entire family can also get on and make changes, etc. Coverage for those new plans would start the first day of the month following plan selection. I believe that was the last slide. So those are just very general overview questions. I do want to emphasize something that tribal consumers may come back to you and say, hey, I didn't get my correct cost sharing. That sometimes happens if the insurance carrier is not familiar with the process or not experienced with the process. They may mistakenly apply the wrong cost sharing. In that case, if they come to you and say that this has happened, hey, I'm an enrolled tribal member, I was on a tribal variant of the plan, I had my referrals, everything was supposed to be okay, but I'm still being billed, then the first question you want to ask is, did the provider submit the claim with the referral? That is how that gets taken care of. So if a referral is required, then that referral needs to go with the claim in order for it to be processed. If it goes sideways and you need help sorting that out, please give us a call, and you can contact me, you can contact Katie Button, but I will certainly work with her to get these resolved if that happens. So as a tribal liaison, I do the government to government work with tribal affairs in the 9 tribes in Oregon. And so we do a lot of things to support the trust relationship with the government and the the tribes and their tribal health communities. So I am going to look at chat to see if there've been any questions. The other thing I wanted to mention, someone asked about, I lost my train of thought here when I looked at the chat because it was not related to this. Oh, someone asked about documentation. So at this time, it is my understanding that self-attestation will be sufficient for tribal members to enroll into a tribal variant plan. If that changes, we'll let you know, and we'll let you know exactly what type of documentation will be required. Any questions so far? Miranda, was there anything you wanted to add to this?
Miranda is in person.
Okay. So,
Free
so
to
this is
change
strictly for
stations
people.
again.
Sorry? Okay. So folks in this room right now are all virtual?
That's correct.
I got you. Okay. All right.
So now if there's no questions for Marina's topic, then we can move on to Abby's.
I have a quick question for Marina. I typed it in the chat. Are alternative health providers for traditional native healing rituals going to be allowed?
It is certainly something that we're going to be exploring. Right now, it is not going to be part of what the carriers have agreed to. That is strictly through OHP.
Thank you.
You're welcome. Any other questions? All righty, we can move on. Thanks for listening, everyone.
Okay. And hello, my name is Abby Maybe. I'm the data quality analyst for the Oregon Health Insurance Marketplace. We wanted to give you a short overview of our current data and reporting practices, including where we get our data and our plans for the future. So we are currently gathering our data through exchange enrollee and enrollment data from CMS, since they are currently hosting the platform for the exchange until we launch the SBM. So they currently distribute their reports to us on an annual or biannual basis, and these include varying amounts of detail. Especially for plan data, including financial assistance statistics. They're often released at the county level, but in less populated areas, we are seeing that there is data suppression for lower populations. So we're not getting the full scope of information that we could get from CMS. And this limits the amount of information that we're able to provide to our partners in a meaningful way. And our team does take the information that we do get and process the data we receive to make decisions and share information that would be the best benefit for our partners and the members we serve. So we work closely currently with our partners, agency, and federal contacts to stay up to date with regulations, rules, and best practices for data and reporting. But with the upcoming transition to the state-based marketplace, the Oregon Health Insurance Marketplace team is transitioning our data governance program to be housed with our vendor for Explore Health, which is Get Insured. So with their processing warehouse and tools, we will have a much more streamlined data pipeline and access to customizable reporting tools. Throughout this transition, our goal is for our data to be more transparent and available. We look forward to working with our communities to improve access to data that serves their populations. And so we did want to take time today to go over any questions you may have, especially if there are any specific data or reporting needs for the OHIM team, or if there's anything you're looking for out of the Explore Health platform. Sorry, it looks like there's some jumping around with the slides. Does anyone have any data or reporting questions for me? Anything about our current work with CMS or our future work with the vendor and different data warehouses that we'll have access to? And if no specific data questions, I know those can be tricky because data can mean so many things. I'm happy to open the floor back up to any of the other panelists to see if there's any lingering questions or things that we can support you with. Tiffany, I see your question in the chat. I'm very new to the team. I want to make sure I give you the correct answer. I might pass that one to Katie or Michael or Victor.
Yes, yes, the agents will be using the same platform. It will just look a little bit different. You will have your own agent portal.
Thank you.
Thank you all for listening to our topics. We have about 15 more minutes in the larger room before our next breakout sessions. So if you all just want to hang out for a few more minutes until we move on to the next topic. Thank you again.
We've got just a few more minutes left of this activity, so if you have any questions for any other stations, now would be the time to change. All right, good afternoon, everyone. I'm going to interrupt conversations. Hello. All right. Hello. Okay. Thank you, everyone, for participating in our breakout tables and online. Thank you, everyone, for participating in the information session online and for flowing with our changes. I know we had some changes to structure there. All right. We've got one more interactive activity before we end our day that we hope you all participate in and stick around for. As we've talked about, the work that we do is really shaped by and all of the regions that we serve. Each region brings its own unique experiences, opportunities, and challenges. The insights and connections that have been shared here today really help us better understand what partners are seeing on the ground and how we can help improve support for consumers across the state. So next, we're going to move into our partner collaboration tables. This is going to be an opportunity to connect with partners in your region, to share what you've been seeing in your communities, and discuss how we can continue to work together to support consumers through the enrollment experience. So for everyone in the room, and it looks like a lot of people have left, so we'll see how this works. We are going to have our outreach coordinators are going to be sitting at tables. And we might have some regions join together if we have smaller groups. So we'll kind of play this by ear. But please feel free to join the region that you feel you best fit into. And then for the folks joining virtually, we do have breakout rooms that you should be able to join. We've got 3 different breakout rooms, so please feel free to join those. And we encourage you to introduce yourself, share your experiences, ask questions, connect with others. You might also talk about, what your plans are for open enrollment, if you are thinking about holding an enrollment fair or any other sorts of activities, kind of start that brainstorming, or if there's any other support that our outreach team can provide. So we are going to be here in this activity until 4, and then we'll all get back together for some Q&A just to wrap up and some closing thoughts, and then we will go home. So with that, I will let you all find your region. Thank you. Just a reminder for those in the room, we have a ton of food and coffee in the back, so please feel free to take some home.
in there, but I Uh-oh. What's happening? That's weird. Maybe they moved us to the next session.
Hello. Can everyone hear me okay?
I can hear you.
Yep.
Okay, great. Thank you, everyone. So we decided that we were going to go ahead and close out the breakout rooms just a little bit early. So thank you for being fluid with us. I just wanted to leave you with some last minute thoughts. And I apologize that you don't have the slide in front of you, but just wanted to kind of close out here, and I will send you the slide deck so that you have all of the information and the QR code. Really want to thank you for being in attendance today. I know that there were a number of technical issues that we were all trying to work through. Being in a space that's unfamiliar to us with a technical setup that is very unfamiliar to us. So very sorry for all of the technical issues, but really appreciate you all hanging in there and participating. And taking the time to be here. And as Chicky mentioned earlier in the day, we do plan on holding a follow-up virtual summit that will be much shorter, where we can discuss some of this content in a virtual format. So if you have additional questions and things, then we will share those. We will also share, we're going to go ahead and I'm going to listen to the recording and make sure that the quality is there and worthwhile for sharing, because I know that we were hearing some feedback that the quality wasn't great on the sound. So if the quality is there, we'll go ahead and share out the recording, but we will absolutely share out the slide deck. And I will also get to you all the partner toolkit and the other resources that we shared here with the folks in person. I do want to go ahead and just leave you with some final reminders before we let you all go. One is that we do have our certification training that all of our enrollment partners will need to take by October 31st. All of the information is currently available on our website. And I'll send you all of this information by email. So don't worry about where to find it right now. Additionally, we do have for all of our insurance agents, if you have not filled out the information form that I had sent out to get all of your information so we can migrate you over to the new system, please let me know. You can just send me an email. This is Amy. I'm the one who's been emailing you, and I will send you that form so that we can get you successfully transitioned over. And lastly, on the slide deck, when I send that to you, there is a QR code and a link with a feedback survey. We hope that you'll send us some feedback. I recognize that there were technical issues, but if you have any other feedback about the content or speakers or anything else, then that would be helpful for us so that we can plan future summits. And we're already thinking about how we can divide up the summit in the future for in-person versus virtual so that we can prevent any of these issues going forward. So with that, I would just want to thank you all for being in attendance today. I know this has been a long day. I know it's been challenging, but I hope that you did get some meaningful information. I hope that you were able to make some connections. And more than anything, I hope that you are excited for the launch of Explore Health. We are all very excited. We've all been doing a lot of testing on the system to see how it's working, and it's working great. So we're just really excited to share the system with you and all of the other great things that we've been working on. So again, thank you for being here, and I will follow up with you all tomorrow by email with all of the things. So thank you again. Have a great day.
Oh, so it's over?
Yes, it's over.
Thank you.
Bye.